Hello and welcome. I am Cyril Stover. The spike in community transmission of COVID-19 continues despite all the measures being taken to stem it. Nigerians must take responsibility, change their behavior, and take this pandemic more seriously. That's what the Presidential Task Force on COVID-19 is saying. Regrettably, however, as the PDF goes on to say, many Nigerians are still living in denial. And this is further fueled by all manner of conspiracy theories, both local and international, and what many see as flagrant disregard for the prescribed protocols by some highly influential citizens. And as a definite cure remains elusive, spurious claims, misinformation, and disinformation continue. Where is all of this going? And what is the true position of the fight against COVID-19? These and other related issues will engage our attention as I sit down with Dr. Chikwe Iheweazu, Director General, Nigeria Center for Disease Control. Thanks for being with us, Dr. Iheweazu.
Great to be on your show, sir.
Right. The spike continues. Community transmission is at an all-time high. We see the figures every day, and yet it would seem that we're churning out and reiterating all the protocols, all the steps that people should take. So what's happening?
Yeah, sir, I think there are two answers to that question. There's two ways to look at the numbers. If you look at our projections a while ago, we really were afraid that Nigeria would have an exponential increase in cases over the last few weeks. Yes, we've continued to have new cases every week, but we really haven't seen that exponential increase. We record about between 500 and 700 new cases every day. It's a lot. But in reality, there are different outbreaks happening in different parts of the country. Altogether, the curve has, remained high, but remained at a plateau at that high level. So what we're trying to do now is really to reinvigorate the response across the country, together with Nigerians and all relevant agencies and partners, to see that we start bending that curve downwards. But, we are where we are. This is a virus. It spreads very easily. Every day we're learning new things, translating it into new advice, and really continuing to encourage Nigerians to, make changes in their lives that are very difficult, but are necessary to take us through these difficult days.
Well, perhaps you'd say you haven't recorded as many cases as you projected. But again, the question is, what's the testing capacity at this time?
So across the country, we have really pushed hard with many people. This is not just NCDC, these are the state governments, labs. We've looked across the country for wherever we've seen some basic laboratory capacity and worked with them to improve that. We continue to do that every single week. So right now we have 60 labs with the capacity to test for COVID-19. So we've brought the test much closer to the people. I think there are just 6 states left without testing capacity in that state. And by the end of next week, we should have completed that. In addition, we have a testing capacity of about 10,000 tests per day. We're doing about 4,000 to 5,000 every single day. That's really because of the collection process of samples. But you have to imagine the amazing improvements that have happened. The supply chain that has to deliver sample collection kits, because these are not things you can just collect with methods that we are used to. The special sample collection kits, the special reagents, special skills, we've ensured that these are distributed across this vast country and bringing tests much closer to people. So every day we're seeing an increase in testing numbers. We're not seeing as an equivalent increase in cases. So that's some good news, but we still have a long way to go. Encouraging people to come for testing when you think you're ill, when you show the symptoms that we've been talking about, and enable us, the opportunity to provide care for you and to prevent you from spreading it to others.
But you might see a need to increase the testing capacity, wouldn't you? Because if you look at the population of the country, well, 60 labs, about 10,000 a day. It's still a long way.
It's a long way to go.
Much smaller countries are doing perhaps 100,000 a day.
Yeah, we're by no means where we want to be, but we have moved on a lot from where we were at the beginning of this outbreak. Just like many other sectors of our economy, we're paying a price for historical underinvestment in the health sector. I think that has become clear to everyone that we really can't we can't underinvest in healthcare. It's the most important thing we have. We can't enjoy phones, infrastructure, electricity. We can't enjoy any of that if we're not alive. So if we need to rethink our prioritization of what we need to invest in health, and even within that health envelope, we didn't really think about health security and what we need to do. But having said all of that, back to your question, we're working very hard. We set ourselves a very big target to test 2 million people by the end of July. We're not going to meet that target. I'm very open about that. But what we have done is really push everyone across this food chain to work harder every day, improve the supply chain, improve the collection. And this is not just NCDC, it's with the states, private partners, our UN partners, and everyone has come to the table. So we realize that the challenge ahead of us will continue to be big until we have a vaccine. But until we get there, the tools that we have at the moment are these public health tools of case identification, bringing you into care, preventing onward transmission, and really continuously mobilizing Nigerians to believe in what we're doing, work with us, and support us in our collective goal to getting ahead of this outbreak.
How significant is the improvement in results from the point of testing and getting those results? It used to be a big challenge, and has that improved considerably?
Yeah, so when this outbreak started, many things were a problem, and we've been working diligently. Sometimes a country as big as ours, the results are not immediately obvious. But if you think about a few months ago, everyone was complaining about access, getting through to the call centers. That's improved a lot. Anyone can call NCDC now, get through almost immediately. The time from collection of their samples to getting your results, there was a significant delay for many weeks. That has reduced a lot. There's one last bottleneck. The challenge right now is not really in the testing process in the lab. The challenge was getting the results to the client, so to speak. So what we're doing, we're launching an online platform so that anyone that has had a test taken will get a code with which they can log on. They'll get a text message, they'll follow that text message and log on and get their results as soon as the lab has those results. We're starting the pilot in Abuja this week in the Federal Capital Territory. The technology platform is set up. So once that works well, we'll roll it out across the country. So that is not a magic bullet, but it's really the solution to the last bit. We've improved the lab testing, we've improved the sample collection logistics. The last bit was the point from, after the test has been done, to get the client their result. And the only way we could solve that was using technology. And so that's the last straw, and I hope that will finally reduce that to a target of maximum 48 to 72 hours across the country. That doesn't mean that's a maximum. We're hoping, we measure our labs by who gets their results in 24 hours across the country.
Now, let's go over to the kind of relationship that you have with the states. And you do find people saying every time there's a talk about COVID-19 testing and results, everything is NCDC. That's not exactly true, is it?
No, it's not. And, remember, state is on what a responsibility of all tiers of government. It's what we call the concurrent list. And especially for public health, this is actually a state government responsibility. So the mandate of NCDC states very clearly support the states in doing X, Y. But having said that, we're in a national emergency, so we've taken on a lot more responsibility than normal. But you would never see me criticizing any of the states. We understand the challenges they have, the limitations. We've worked very closely with state governments. Some came to the party earlier, some required some convincing, but every state in Nigeria is now working very closely with us. And I really want to give credit to the leadership of some of the states where there were initial challenges. You know, when you're faced with a big problem, it's daunting, and somehow you hope it will go away. But my point to every state in Nigeria, you know, this is a virus. It doesn't, how you respond is so important, because the number of cases you have doesn't really say anything about whether you're managing your state well or not. So let's leave this in the technical hands of people that understand the response. We're working very closely with the states now, and our leaders, both at the federal government and the state government, are really providing us the political support to
so
continue our work.
You like the states and everyone else to take politics out of this health emergency, and it's not the question of you testing more, you testing less, and these are also issues that beclouded the whole process. Whether if you test much more, you're likely to get more funding, or if you test less, then you're the champion of having governed well. These issues are not
not at all. And that's, I think, the phase we needed some time to get over. But now we see that this is something that, you know, there are very few things that bring out that collective responsibility. Because just like, imagine a family at home, you live together, right? You can't say one part of that family will do well and the others, you know, can do whatever they like. Our success is mutually dependent on each other doing the right things at all levels, from the family level to the country level. So every state in Nigeria, for instance, is surrounded by other states. And this is a virus that is transmitted from person to person. So you can have all the great measures within your state, but if the states around you are not doing exactly the same thing, you're always vulnerable to reintroduction and reinfection. So like never before, this has called on our collective efforts. And that's why I'm really proud of the work Mr. President and the Presidential Task Force has done in bringing states together, creating a multi-sectoral presidential task force. So it's not just seen as a health sector response, ably led by the Secretary to the Government of the Federation, that has really brought in everyone that needs to play a role in this response. And yes, it took a while for us to get there, but I think now there's increasing recognition that the only way we'll get ahead of this is by working together.
There was some form of incapacitation for the NCDC itself at the start of this. Let's face it, no one envisaged a pandemic of this nature, and probably the NCDC itself was not in a position initially to respond immediately. After all, you did have things like other viruses, like the one we have dealt with year in, year out. So how has it been since the big outbreak of this, and how have you been able to build up the capacity to respond?
Yeah, Cyril, you know, for many years I would speak about the risk that we all face, but everyone really thought it was a hypothetical risk. And you know, when you hear about a few cases of cholera or Lassa, you say, okay, those poor people somewhere other than from where I am. And we thought that, you know, this wouldn't happen to us. And if it did, there was an exit plan. So we were faced with a situation early this year where, firstly, there was a new virus that seemed to infect all of us, irrespective of your status in society. And secondly, there was nowhere to run to. The airports were shut. there are no flights. So everyone came to the realization that, listen, we actually have to do something about this. And we were actually in a good place relatively, that we actually had an organization whose mandate it was to do this, just that we hadn't paid sufficient attention to it over the last few years. But thankfully we had a small but incredibly dedicated group of colleagues that understood what needed to be done. I think the challenge was just, we had an outbreak that suddenly we had to respond in every state in Nigeria. Never happened before. So normally you would have an outbreak in one state or the other, and we would use all our resources to focus on that small corner. But you had to suddenly do the same in parallel at the same time across this vast country. So we had to quickly scale our efforts, recognize some things cannot be done in a hurry. You can't train a virologist in 2 weeks. That requires 6 years. But, we used whatever means possible, pulled in others into the organization, worked with partners, the UN, the private sector, and really, I think some of the lessons from this outbreak will be learned for many years to come. There are some obvious ones in terms of rapid scale-up of infrastructure. But if you think about, let me take something outside of NCDC, how the private sector has come together, as CACOFID, so the organization of big private sector conglomerates, and not say, let me compete with each other on who is giving more rice or more test kits, but organize themselves to support the work the federal government is doing. I can't remember a time in our history where something like that has happened. And I really hope that we're able to take some of these examples that have happened in a period of crisis and also, use it during peacetime to improve our collective capacity across Nigeria.
Well, COVID is said to be affecting just about every facet of human life, including the health sector itself. Is there any chance that with the attention on COVID, attention to things like Lassa fever, cholera would have waned?
Yeah, so, my strategic objective, and I say this to everyone in our team at NCDC, is we must always keep our eyes on two goals. One, absolutely, is to manage the outbreak in front of us at the moment. But it will be a disaster if we come out of this outbreak and we're not a lot better prepared for the next one, because there will be a next one. These viruses are a lot cleverer than we are as humans. They evolve very quickly. This particular one
This is not like a prophet of doom.
It's not. It's a reality. We have to face it.
There will be a second.
There will be a second big outbreak, a pandemic. How quickly, no one can predict. But this virus is so well adapted. When people think about Ebola, they think, okay, it's a dangerous virus, and that's true. But Ebola kills everyone it comes in contact with so quickly that unless it comes up in a crisis area, like recently in the DRC, it doesn't have the opportunity to transmit as quickly because most people would die too quickly to transmit, right? This particular virus, because it affects a large proportion of people that show no symptoms but are transmitting, is very well adapted. So we've got to build for the long term the Nigeria Center for Disease Control and other agencies with similar responsibilities to build the capacity to continue to be ahead of the curve. And so one last word on this is, apart from the NCDs itself, we have to really rethink on investing in rebuilding our science education, because it is those scientists that we train in universities that will come out and be the pool from which we will pick the best to work in an organization like ours.
All right. Take responsibility. That's what everyone seems to be saying. But are Nigerians taking responsibility as they ought to?
So, obviously, we're not where we want to be. Firstly, but I also want to recognize how challenging this is. We are asking people to wear masks every time they leave the house. We're asking people not to hug, not to dance, not to party. We're asking people to change what makes us, in a way, Nigerian. We are a social people. We love each other. It's the thing that stands us out in the global space. So I can deeply understand why it is so hard. But I also know that the other aspect of our strength is when we come together to do something and accept that this needs to be done. And why it is so important is the whole concept of wearing a mask is of no use if you're the only one wearing it. So because what the mask does is it really prevents transmission from those that have the virus but may be asymptomatic or pre-symptomatic, which you don't know. So it only provides value to society if enough people are doing it at the same time. And mass gatherings, per definition, only make sense if we're all distancing ourselves from each other. So in a way, this is not something, we're very entrepreneurial people, and people are used to taking responsibility themselves. But we are saying that beyond taking responsibility yourselves, you also have to really push that whatever community you're part of takes collective responsibility. And we're all part of different communities. We're part of social communities, we're part of religious communities, we're part of professional communities, and we should all use our influence to drive that change and say, listen, some of these measures are things that we need to really push hard for the next few months, and then we can drop them. I look forward to walking around without a mask, and I'm sure most people do. But there's some things really, if you think about the focus on hand washing and the need to provide those facilities across schools, universities, and everywhere. I really hope that that's one of the measures that will last, well into the future, and that we take hygiene and all of that much more seriously than we currently are. So for some measures, yes, we hope for really a defined period that we can start hugging each other again. For others, like hand washing and personal hygiene, I really hope that there's a fundamental change in culture in how we address those issues.
Well, this whole thing is not being helped by the nature of this virus, and more people is living in denial and saying, look, perhaps there isn't a COVID-19. Some would say, well, I don't know of anyone I can point to directly and say he's had COVID-19. And yet others say, well, it still is a disease for the privileged, because the only people who have come out, well, most of the people who have come out openly are those who are in the upper echelons of society.
Yeah, so, this is really, we're 6 months into this outbreak, and, in the position of privilege I happen to find myself in, we've come into contact with many close friends and people I've been in contact with, or people I've met along this journey that have either been infected and recovered, and some who unfortunately haven't recovered. And it's really not an experience I want to wish on anyone. It's a very difficult disease for those that are unfortunate to have the severe symptoms. And we look across the world. This is not just Nigeria. You look across the world, we're talking about 16 million cases so far, and growing every day. And we see countries really struggling. If you look at a country like Brazil or India, they're not that different to us. We see the number of fatalities they've had. So this really is a bad virus, but we need to bring a few more voices onto the stage. From the NCC and the Presidential Task Force, we say this every single day in our press briefings. We go around the media. But, I really want to call on Nigerians across the spectrum of society, religious, traditional, business, to really lend their voices to this and support each other as we confront this. Yes, at the beginning of the outbreak, those most infected and affected were people that had access to travel. So there were many people too, students, that are not necessarily part of the elite. Many people raise money and send their children abroad for an education. And many of them got infected. And that's really what defined the early part of the population that was infected in the very early days. But if you look at the demography now of those infected, it's definitely not the elite. It's a whole spectrum of society. And in fact, chances of survival are not as great if you don't have the resources to support you through that journey.
Yes, but again, the public would say they're not seeing that, and there's a stigma that's still going on. How bad is this? Because I still think that maybe 70% of those who own up to having contracted COVID-19 are highly placed individuals. You hardly find people at the lower rungs of society to admit. So it keeps reinforcing the belief that perhaps this is just for the big men.
Yeah, I think I'm not sure it's really status only. It's really about how we talk about health in our society, whatever infectious disease we're unfortunate to have contracted. So, we want to send out a positive message all the time that this is by no means the end of the world, even when you get it. Our opportunity to treat, to diagnose and manage is getting better. We're learning every day. Both in terms of how to provide care, how to reintegrate. And there have been some great examples of people that have come out and told very positive stories about their experience, both in care and how they've recovered. So the key thing really is to let Nigerians know that, yes, you can die from this, but 98% of people come out of it and rejoin society. And Nigeria needs all of us to continue to engage. Our families need us, and collectively we will keep pushing to get ahead of this.
Well, which brings us to the nature of treatment and the care, and there's still no unanimity in how it's done. Some people say this was what I was treated with, others say no, I was not treated, and this again has made it difficult to know if there's any specific mode of treatment. Is it that this virus has to be treated based on individual presentation, or what?
So firstly, this is a new virus, right? And with every new virus, science has to catch up very quickly. And there's not been a virus ever for which research has evolved as quickly as it has for COVID-19. So firstly, this is a respiratory virus. For most viruses that we know, the body finds a way of responding, and no less so for COVID. And that's why the modes of presentation for this virus are so different, from completely asymptomatic to mild to severe cases, and there's really no way of predicting who gets what. So firstly is to remember that 95% of people will recover on their own. So whether they drank water before recovery, or whether they ate food or took whatever medicines, they would have recovered anyway. So that's the first bit. The second bit is the primary mode of management is respiratory support. So it affects the respiratory system. So what we do is, for severe cases, we provide them supplemental oxygen so that their respiratory system continues to work while the body recovers. We do that through oxygen concentrators, and in very severe cases, we move to ventilators. And eventually, in many cases, the body responds. There have been 2 medicines only globally that have shown any effect on the outcome, on improving mortality and morbidity. One is remdesivir, a drug that was found primarily, or investigated primarily, for Ebola. It was found not to work for Ebola and was tried for COVID, and it reduces the time in hospitals for severe cases. So we're very happy with that, but it's a very expensive drug that moves now to make it a little bit more accessible, so we don't have access to it yet. The most exciting breakthrough a few weeks ago was a drug called dexamethasone. This is a drug that's been around for a long time, And we now found that in severe cases, it really improves mortality. So the number of people that ultimately pass away in severe cases. So those are two. There are many others in the process of clinical trials at the moment. But there are no shortcuts to these trials. They have to be done, and colleagues are working very hard to get to the top of this.
But again, you'd see that the old controversy over chloroquine, hydroxychloroquine is back again. And how do you handle this?
So really, there's no controversy in the scientific arena. There have been a few studies, carefully designed studies, that show that both hydroxychloroquine and chloroquine have no benefit, and in some cases actually produce harmful outcomes in people. And there, there are many people that say, yes, I took chloroquine and I got better. They would have gotten better anyway, because a large proportion of these people get better because the body responds. And science is beautiful and is difficult at the same time, but it's the basis of what our profession is built on. And yes, the ultimate clinical decision by doctors to manage a patient is the decision of the doctor in front of the patient, and they have to have that conversation with the patient on what they're managing them with. Our role at the Nigeria Center for Disease Control is to provide evidence-based guidelines, similar around the world. And thankfully, we're not the only country where these anecdotes are thrown up. But there's consensus among the professional groups, the scientific world. This is what works, and we will continue trying to demonstrate the effect of other drugs. But there's no magic bullet, and science doesn't work by people shouting in microphones on pulpits or on the stairs of court houses. It's really a diligent process, because the responsibility on us is huge to give people medicines that help them, and rather than cause harm.
So far, up till date, no specific cure. There are trials going on with certain remedies, but no specific cure, or say this medicine cures.
6 months. 6 months is the period of time where we've known about this virus at all. Think about HIV. 50 years since we discovered this virus. We still don't have a cure. We have drugs that suppress the disease and enable people live a normal life. But there are many viruses like that. There are others that you can prevent with vaccines, and that really is our best shot at this. And in terms of the research around vaccines, is really where the most exciting progress in medicine is happening right now. Vaccines are already the most amazing discovery mankind has ever had. But to develop a vaccine in the timelines that the world is working at right now has never happened before. So I am excited about the prospects. I know we will go through a difficult period, but from the insights I've gained into the existing clinical trials into vaccines, I am optimistic about the future.
Well, vaccines, as you well know, are another controversial subject, and in some parts of the world, even existing vaccines, it's still tough to get people to accept them. And when you think about all what has been spun around COVID-19, talking about all the conspiracy theories, it would be tough for this part of the world, wouldn't it?
I don't think so. Cyril, I've been in vaccines. It really depends on how it affects you. 4 years ago, we responded to a meningitis outbreak in the northwest of Nigeria. Lots of people died, and when we finally got hold of a scarcity of vaccines, when we got hold of the vaccine, there were queues of people. Really, we had to manage crowds to enable access to those vaccines. So I really think the challenge with vaccines sometimes is a risk perception around the disease itself. And I think enough people want to get back to a normal life. I want to hug my family again, my friends, and the only way I can perceive doing this in the short term is by getting a vaccine that works.
Well, 90% or thereabouts will recover. Are we certain that those who contract COVID-19 and recover are not likely to come down with it again?
So this is one of the most important questions being asked at the moment. At the moment, we don't think so. I say that very carefully because the only way you can know if they'll have the disease again, you need time. Because you need to study people over time to know whether the disease will reoccur or not if they have recovered. And we simply don't have enough time yet. So we will keep looking at this over time. There have been a few cases that we've wondered, but whether this is a reinfection or not. In most cases, it turned out that this wasn't a reinfection, it was a persistence of the virus in people for a longer period than is usual. But that's one of the reasons why I said, you know, the investigation and the work going on to learn more about this new disease is so important. And our responsibility in Nigeria is to be part of that research process, to learn more and to use the new knowledge that we're gaining to define and design the response that is appropriate for our country and for our people. No one else will do that for us. Studies going on in the US and the UK will be done on people living there, and they will benefit from the results the most. So we need to re-inspire a whole new generation of scientists to study these very difficult issues in our country.
Well, while we're on the subject of recovery and other ailments as well, despite all the appeals by the PTF, for instance, and many health professionals, there are still reported cases of health institutions turning away people, patients, and of individuals themselves being too scared to attend hospital when they are ill. Everyone seems to be scared of going to a health institution.
Yeah, and you're absolutely right, and you can see it from our data, our immunization data, our access to health services, even on the website of the Federal Ministry of Health, a great resource for anyone that wants to look. And we're really struggling to keep up all our other health indicators. And yes, there's a lot of fear and anxiety around hospital settings, and some of it is justified because you are at a greater risk of contacting this virus if you're in a hospital that is not working to the standards of infection prevention and control. So one of the biggest efforts that we have led on at the Nigerian Center for Disease Control is our work around infection prevention and control. What does this mean? This means retraining all our healthcare workers on the appropriate use of personal protective equipment, the appropriate behavior in terms of hand washing and moving from one patient to the other. And that's one of the things that we hope will stay beyond this outbreak. That's one. The second bit is the Honorable Minister of Health recently directed all hospitals under his purview not to reject any patients. And we're working with these hospitals, especially in the federal government architecture, to ensure that they have the opportunity to test quickly, to take a sample and to test. So in the hospitals in Abuja, for instance, triage settings are being set up in front of those hospitals once you come in. So if you're suspected to have COVID, you can be tested. Because the key thing in turning around patients is turning away patients. Doctors are afraid of themselves contacting it, and patients are afraid. So if we manage that anxiety and provide a process where we can separate those that may have it and those that don't, then we will rebuild the confidence in the system. But none of this will solve it immediately. It's a process of rebuilding trust in the whole healthcare architecture in Nigeria that has been received insufficient support for many decades. But I have no doubt about it. Both the federal government, even the National Assembly, everyone is so focused on building back better for the future. The challenge we have literally is that, you know, some things take time, and we will need a bit of time to build this ship while at sea and build it to be strong enough to carry us way into the future.
Let's turn to those who are considered to be at higher risk of contracting this disease and who have reduced chances of coming out of it. Said people with underlying ailments, older citizens, And when you take these and apply what is called social distancing or physical distancing, either which way they're bound to suffer from it, because you stay away from the elderly or they stay away from the people, they're some form of isolation, really.
Definitely.
And these are the people, the segment of society that needs support and attention much more than others. How do we balance this?
This is what makes this virus so difficult for us as a society and as a medical profession and people. But firstly, to say there's really no evidence at the moment that there's a difference in vulnerability to transmission. The difference is in the impact of the virus when you get infected, right? So the chances of a severe outcome, the most severe of which is death, is higher the older you are. And this really has been at the center of a lot of the risk communication work that we've been communicating tonight, sharing with Nigerians. And we really have to think about ways to mitigate this risk. It's very hard to get any risk to zero, but there are different ways that we can come up with together as a society. And this is not really something that a health professional, a medical professional can preach about and say this is the way to do it. In a way, what has protected us to some extent, if you look at some of the big outbreaks in the West, is we don't really have that communal living with the elderly, where people are in older care, elderly people's homes. And that's really cost a lot of the mortality that we've seen in other societies. Thankfully, in our society, that's not really the case, but we still have, of course, elder citizens, older citizens in our context, and we have a responsibility to protect them. And a lot of that is dependent on the efforts of others. And so what we're really encouraging people is to come up with solutions that we can think of together. And some things we can pass on, you know. So we advised the elderly, for instance, religious service is important to all of us. But for things like that, if we could avoid going to places where you can put off for a few months without severe penalties, then, you know, save yourself that anxiety for a few months. And once we have a vaccine, we look forward to really reintegrating everyone. But it's by no means an easy task we have. And you're absolutely right in terms of the other health outcomes of isolation, and something we have to work collectively to get around.
For now, for those who come down with it, there's also the challenge of determining whether they succumb to COVID-19 or to the other challenges, health challenges they've been having. At what point do you determine that it's COVID that has either hastened the demise of a patient or has caused them to go under? Someone who has been battling with hypertension, for instance, at what point would it be that it was COVID that, you know, caused their death or the ailment they had? Isn't that really difficult? And it's part of what leads to the controversy that some of these people who have died have been passed on as COVID-19 deaths, and which is not really true.
Yeah, so that is a really important question, but our goal is to prevent deaths altogether. And there are many ways we're doing that. You know, we found out that in some hospitals, you come in with what we call a comorbidity, which almost all of us have, one thing or the other, right? But you also have COVID-19, and we need the specialists in some other area of medicine to have the confidence to come to you to manage your other underlying illness. So we've been working very hard to make sure that the care for COVID-19 is integrated into the hospitals and people understand the risks and how to protect themselves, because there are very safe ways to practice. You know, one of the great examples I love to give is in Irua Specialist Teaching Hospital in Edo State, one of our premier infectious disease hospitals in Nigeria. An example always given by the chief medical director is those doctors that are used to managing Lassa in the Lassa fever ward. That's where we have most of our cases. None of them have ever been infected by the virus because they're used to the processes that they need to protect themselves. The healthcare workers that do get infected are those that are not used to Lassa and that are a little bit careless with some of the precautionary processes that we need to take. So what we want to really build among our entire health system, because nobody comes to the hospital with the sign COVID in front of them, is how do we establish a safe set of practices? This is from behavior to PPEs to practice that enables all the specialists that are involved in the care of our elderly to have the confidence to provide that care.
It's happened in other parts of the world, particularly in the West, but we're hoping it does not get to that situation here, where because of the number of cases, health professionals may be forced to choose who to attend to save resources for others. You see that because now we hear that because of the number of cases, bed space is beginning to be a challenge. So at what point would we say, oh, well, this is a 90-year-old with so many underlying health challenges, and this is a 40-year-old who would have access to
We hope
this
never to get to that stage, and it's really why, as we think about the future, we have to make some strategic decisions. Some countries in the West that have managed this the best are those that have built up a redundant capacity, especially intensive care, because when you need it suddenly, you can't just build it up. So when we started on this outbreak, we looked across the country. We had just about 300 intensive care unit beds. Definitely not sufficient for a country like Nigeria. So the Presidential Task Force has really prioritized some of these things to prepare us not only for this outbreak, but for also to prepare us for the future, in which we have to just be a little bit in a better place, even if the beds are not filled up. So I hope we never get to that place. It's very difficult for any practicing physician to have to choose who to intervene with in a situation like this. So that's why we need all Nigerians to really focus on prevention and to work with us to do these things that we've been preaching about: mass hand washing, avoiding mass gatherings, so that we don't get to that situation.
All right, the appeal to all Nigerians, the masses, to join in, and that takes us to the next angle of it. As part of the PTF, this form of advice is churned out on a daily basis. But now we see reports, even as the lockdown has been eased, we get reports of very important personalities who are flouting all these, protocols and getting away with it. How dangerous is this?
So leadership in our context is so important, because we really look up to our leaders in Nigeria, and when someone in a position of privilege and responsibility doesn't do what he's supposed to do, it has severe consequences not only on him individually, but on so many others that look up to him or her for the leadership that is needed. So I guess all I can say is really we need our leaders to stand up and lead not only by what they say, but by what they do. And these are simple gestures that will save a lot of lives. Having said that, I think on the whole, yes, there are few examples of people that haven't fully complied with what we've been asking. But I think, Cyril, if you look around, you will see that the vast majority of our leaders in this country are actually doing the right thing, showing leadership, And I think, let me hold on to that and hope that we will convert the last few.
Oh, well, sometimes
into
the small minority have the capacity
Yeah.
to influence
Absolutely.
larger segment.
Yeah, no, you're right. But I remain hopeful and optimistic about the power of the majority in this case.
Okay, so, well, we've been told that this is one period where we have to look inwards and seriously reconsider how health systems are practiced here. How so is this at this point in time?
Yeah, so this really is the underlying basis of everything we reflect on. We have to reprioritize our health as part of our national conversation. Our leaders have taken some responsibility and said, yes, we have maybe not invested as much as we should have. But, you know, I would guess if you ask the average Nigerian, listen, what are you worrying about, or what would you place on your politician's agenda for the next election? I don't think health will come up that list, and it's something we really have to rethink, because you know there are competing demands for resources in our country. We have many problems, so we just have to focus on health. People don't place a value on health until it's lost, so we have to invest in many aspects of healthcare provision, on health insurance, on primary healthcare, in ensuring that some of our tertiary hospitals really are tertiary hospitals in the real sense of the word. And finally, on health security, on this issue around infectious diseases and how we invest in building the laboratory infrastructure, infection prevention and control, and the things that are directly under the remit of the Nigeria Center for Disease Control, in order that we sleep well at night. Because the work that we do at NCDC is a little bit like what an insurance company does. You know, nobody likes paying for insurance on anything, because you're not paying for insurance because you don't want a fire in your house. But we all pay for fire insurance because we want the day there's a fire for us to have a source of recourse. We don't pay for a car insurance. It's a painful expense because no one pays and wishes to have an accident in order to recoup the funds that we've paid for insurance. So really investing in infectious disease prevention, detection and control is an investment that we need to make so that we can sleep better at night, knowing that if there was an outbreak, if there is something, you have a group of people that understand what it takes to respond and are able to deploy those resources.
Well, two things as we prepare to round up, other people still, that there's a high chance of a second wave of this pandemic. And even when you begin to record some appreciable success in treatment and management and more people coming out of it, now is not the time to take the foot off the pedal, because there might well be a second wave. Now, there's been talk about herd immunity. Can this play any role in that? Or would you say perhaps why we're not seeing the numbers that we had expected to see is some form of herd immunity has happened here in this country?
Yeah. So firstly, I think we're still very much in the middle of the first wave, and that we will have a second wave is not inevitable. It depends a lot on what we do collectively as a country. And that's really the most important point. If we really focus on these things for the next few months, we will reduce the rate of infection sufficiently for us to hold on a bit until we get to a vaccine. So really want to push on that concept. In terms of herd immunity is never a strategy. It is what happens when you don't have the tools, when you don't have a vaccine. Before we had the measles vaccine, what used to happen was people get infected, there's a big outbreak, many people die, but as part of that, the population has some form of herd immunity for 3, 4, 5 years, and then there's another big outbreak. But it is what happens when you don't have the tools to respond. But herd immunity in itself is not a strategy. So what we need to do is really use all the tools, all the resources that we have at the moment to do the very best that we can do, while working on the development side and new therapeutics, new vaccines, new diagnostics that will get us out of it altogether. But we don't have any choice at the moment to use the tools that we have. And unfortunately, some of them are very blunt, and inefficient, like mass gatherings. But it's all we have right now, while we keep pushing to get new tools.
Well, finally, re-emphasize this for us, would you? In taking responsibility and ownership of this fight, it goes beyond just what the PTF or the government says. I've been to shops where the notice says, where it was, that is what the government says. The message is lost somewhere. It's not wear it because it might help you, stop you from infecting other people or being affected. It's just, well, the government says so. And so sometimes you have situations where people look around and say, well, officials are not here to enforce anything, and look, just come in quickly and do it. So as we round up that.
So I think this is such a great place to end. When we say take responsibility, I wish there was a different way to say it, so that we're not offering you something you can take, that this is something I am accepting because it is part of what will keep us alive collectively. And so this is really an appeal to everyone that has some influence over how others behave. And sometimes we don't need to wait for the ascribed leader in a society. I have been at home where my son, you're about to run out, and my son pulls me back and says, Daddy, you've forgotten to wear your mask. Right. So I really want everyone to take responsibility, not just for their own behavior, but by supporting everyone else in our communities to do what we need to do collectively to stay alive.
Dr. Chikwe Iheweazu, Director General, Nigeria Center for Disease Control. It's been interesting talking to you. Thank you for coming on One-on-One.
Thank you, Cyril.
Thank you. Right. And that's our program today. Thanks for watching. Next week we'll be back with One-on-One. I'm Cyril Stober. Stay safe.